Do you need the glasses?
Yeah. Sorry. Thanks. Perfect. Thanks.
All right, I'll sign it.
No, you don't have to. Did you click in yet? Doc, did you click in? Did you click in? Pardon? Did you? Pardon? Okay. You're not here yet. Might have to do it another way. There you are.
Okay, where to go?
Right here. I see you.
There you go. Okay. No, I clicked off. Okay.
Well, welcome, Dr. Bill.
Long time no see. We haven't done this for a while.
No, we haven't. We got a lot to do. Well, tonight we're going to really talk about TBIs and Exomind and how we can help people.
Okay.
First, can you briefly tell me about traumatic brain injuries and how it affects an individual across different severities?
Okay. Well, it's what it sounds like. You get hit in the head, and the the brain gets injured. The brain takes up about 20% of our calories and our energy, and it's the engine that makes everything else go. When you go to pick up a pen, for say, so I'm going to pick up a pen here, and my brain has to tell my hand to do that, and then and to carry out all of its functions. The brain has millions and millions of cells called neurons, and they have little gaps between them, and it's a very delicate structure. That's why it's in a hard shell here, the skull, to protect it. Unfortunately, as we got more and more advanced, we get more. It's easier and easier to injure the skull and everything that's underneath it. So traumatic brain injury is classified as mild, moderate, or severe, and there's specific criteria for each model. So 75% of the traumatic brain injuries are classified as mild, and that's basically a bump on the head. No loss of consciousness, or if there is a loss of consciousness, it's less than an hour. And usually, the person has a ringing in the ears, or they're dazed for a little bit, and within a half hour or so, they're back to normal. That's a mild.
I have a question. Like a person that has a concussion, they could also be a TBI, correct?
Yeah, well, usually that's a concussion is I hit my head. There's no structural damage that's been detected, and I may have been incapacitated for a while, but I've gone about my business more or less. Okay, moderate traumatic brain injury is usually has some loss of consciousness, less than a week, longer than an hour, and severe is anything that's over 7 days. Um, and severe traumatic brain injuries cause loss of consciousness, long-term disability, um, and any type of traumatic brain injury, even a mild one, can cause personality changes and mental incapacities. Um, and depending on the area that is affected or injured, you can have really can have lasting effects, lasting consequences.
And how do they usually diagnose a TBI?
Well, sometimes it's clinical. Again, different criteria, um, uh, brain, what we call brain fog, changes in personality, changes in behavior. There are some of the symptoms. A CAT scan, MRI can pick up structural changes. Sometimes we need to do vascular studies if there's a blood vessel involvement, and in more subtle cases, there are more subtle studies that can be done. There's PET scans. There's this DTI, which kind of looks like a psychedelic Andy Warhol painting that will pick up abnormalities.
So, what are some of the most common and challenging symptoms of individuals with TBI experience, both physically and cognitively?
Well, those that have an official TBI, whether it's mild, moderate, or severe, almost 100% of them will have some sort of fatigue that can last anywhere from a day to a week to 3 months to an extended period of time. 77% of these patients have depression and or anxiety, and then other symptoms include headaches, dizziness, fatigue, visual issue problems, sleep disturbances, and the one that sort of clinched it for us, and as we're the hormone folks, and remember where the hormones are generated.
Is in the
So your
pituitary gland.
is right in the center of the brain. Remember, it's if you draw a line from the under your chin to the tip of your head, and then from ear to ear, where they meet in the center, you have the hypothalamus, which is sort of the higher organ that creates hormones, and then that leads to the pituitary, which distributes, the messengers to have the hormones generated. So you shake up the brain, you're going to shake up the hormonal abnormalities, and a lot of the symptoms end up being not right away, not within the first 24, 48, 96 hours, but down the road a piece, 3 months later, 12 months later. We've even documented up to 17 years later after a head injury, hormonal abnormalities that contribute to the behavioral personality changes that we see with head injuries. We sometimes see substance abuse, new onset substance abuse, but the one the one key that sort of again clinched it for us was what we call executive function, the ability to get things done, starting projects, finishing projects, multitasking. Um, uh, Obsessive compulsive tendencies can be a growth hormone issue, and growth hormone is generated in the pituitary, and it's one of the first hormones that gets disrupted with a traumatic brain injury.
Because I've seen some patients with really bad TBIs and they lose their ability not to walk or pick up their
Mhm.
arms.
Right. Yeah, and again, it depends on which parts of the brain are affected and for how long. And it has you need oxygen to the brain, you need blood flow to the brain, and what happens is when you get brain injuries, the brain can get smashed to the other side of the skull. That's called a contracture, and the brain cells, get disintegrated and crumble.
So, what are some of the current and traditional symptoms to treat for TBIs?
One of the traditional, what was the
Traditional
question?
treatments
Oh,
approach.
well, early on, the out there, you may not know, but I was an ER doctor for 10 years when I first got out of school and when first went into practice. And this was before there were emergency room residencies, and we were kind of we did it for to make extra money. Actually, we're making $275 every 2 weeks, which didn't go very far. Um, so it was rest for at least 24 hours. Don't let the patient fall asleep. Keep them awake and keep them moving. And when we think about it now, I don't know why we did that. I guess we didn't really have anything else to offer, but don't let them fall asleep. So, and that was the sort of the pretty much that was pretty much it. Obviously, if they had a vital sign issue. So if they weren't breathing, we would do emergency CPR, intubation. You want to make sure that they're not having any bleeding in the brain, because that can cause brain swelling, and you lose brain function that way. And the brain has no place to go because it's in a solid case here, and it'll go down into the brain stem if we get brain swelling, and that's where you end up with really brain death.
So, what are some of the new technologies for treatment for treating TBI patients? I know there's different machines out there. I know there's different.
Well, there's yeah. Well, there's so again, I mean, the tried and true, is always lifestyle, good diet, make sure you get some exercise, don't smoke, if you are riding in a car, wear your seatbelt, all of those good things. Eat good fats, limit your saturated fats, those kinds of things. So that's always number one. Number two, there are any number of again now online. There's brain stimulation. There's games. There's tests. There's light therapies. Those kinds of things. You can do those online yourself. You don't need a therapist for that. For things that are a little bit more severe, obviously there's physical therapy, occupational therapy. And medications, of course. But what we found is that there's especially with head injuries, there's what we call treatment resistant entities. A lot of these patients, like I said, 77% of them end up with some sort of new onset depression, and a lot of times the medications, their standard medications, your SSRIs, your SNRIs, so your Prozacs, your Effexors, even the atypical ones like uh, uh, I forget what Wellbutrin.
Wellbutrin.
Yeah. A lot of times they don't work. So then, the standard of care is to add a second antidepressant, and then even a third, and then by that time we start having side effects from that. So then we have to add drugs for the side effects, and it becomes kind of a rolling, almost catastrophe, because then we get side effects from the drugs from that to counter out the drugs from the side effects. So it's not uncommon to see somebody taking Adderall or Ritalin, uppers during the day, or Modafinil uppers during the daytime, and then they have to take Zolpidem, Ambien to sleep, and then Valiums or lorazepams, as calming agents. It sort of turns into a vicious cycle. So there is a blood test that we do, again, a hormone that will actually let us know whether the patients, will be responsive to those kinds of medications or not. It's called prolactin. Again, it's easy to do. Prolactin is typically known, one for it's elevated for that. That's how mothers, when they're breastfeeding. The prolactin is the hormone that gets stimulated to make breast milk. When prolactin levels are very high in women and men, it has nothing to do with pregnancy. It's usually a tumor in the pituitary gland. Most of the times it's benign. Um, and that's a sort of a screening test for that. And we do prolactin levels on everybody, and we actually pick up pituitary tumors earlier than years before they would have been. Um, and I remember I found 3 in 1 week once, and I always send the patients to the neurosurgeon to see if they need to have them removed. And he called me up and said, "Well, what are you doing?" He says, "You're not." So again, I'm a family doctor. I'm supposed to diagnose 1 pituitary tumor in 30 years, and we've been doing the prolactin levels regularly now for probably about 10 years, and we've probably found about 20 of them. And most of them are small. We can just treat them with medication, before they get out of hand. But what we're really looking for with traumatic brain injury is the prolactin levels that are low, under six. When the prolactin levels are low, under 6, that's a clue that we've had a residual traumatic brain injury, or some sort of brain event. And the traditional medications, for the most part, do not work when the prolactin levels are low, when they're under 6. So that's really a key and a clue. Whether there's really some severe trauma in the brain. And again, we do that routinely. I do that, the prolactin level, on every patient we see at least once. So those are sort of the conventional ways of taking care of it: occupational therapy, speech therapy, physical therapy. All of the regular uh, um, uh, modalities.
Now, can somebody get their executive function back in the brain after a TBI?
Yeah, yeah. We can restore it again. It takes work sometimes. We need somebody, they need to do. They need to put in the work. It's just not going to happen on its own, and you need to be able to find folks who are cognizant, because this is. I've been doing this for 10 years, and it's still a big surprise. And some of the sort of the powers that be, like the VA, sees a lot of head injuries. At first, they laughed at us, then they made fun of us, then they tried to run us out of town, and now it's become part of their protocol. So that's the way progress is made. So we try to have a kind of a thick skin about it. So.
Well, I would love for you to talk about your new piece of equipment that helps the mind, the Exomind technology.
So that's what comes next. So transcranial magnetic stimulation. So stimulating the brain without needles, without medication, has become the next big thing. There's a number of ways to do it. There's light therapy, and that works to a certain extent, but it's sometimes difficult to get light through the skull and into the brain. So we get some partial relief with that, but transcranial magnetic stimulation. So the same technology as MRI. It's running a current through a magnetic coil to create an electrical charge. And what it does is it stimulates the brain to contract and relax. And so it stimulates the brain to work. The upshot of that is that it increases blood flow to the brain, and it actually increases the brain's own regenerative function, particularly a substance called brain-derived neurotrophic factor. If you read about this, it'll be lettered BDNF. It will increase that, and it will increase the number of brain cells, so we can actually make you a little bit smarter. How much smarter? Everybody's an individual.
Well, and I think one of the big things too, it really helps with the neuroplasticity of the brain.
Exactly. Well, that's what I'm talking about.
Yeah.
Okay, so we're talking about neuroplasticity means exercising the brain. So when we tell somebody do brain exercises, do do puzzles, do make sure your brain is active, especially as you become older. Make sure that you're keeping it moving. The study done, the famous study done about 8 or 9 years ago, found that ballroom dancers had a 93% less incidence of dementia and Alzheimer's disease than those who were not. I mean, that's pretty significant. I
That
mean,
is.
it's like, boy, someone who was a just a moderate, is not, it's not, we're not talking about professional, but somebody who goes maybe 1 or 2 times a month to a dance and maybe takes a dance lesson every couple of weeks will have 93% less incidence of dementia than those who don't. So that's pretty impressive. I mean, that's really a sort of a testament to keeping yourself active, keeping your brain active. And dancing, you have to be upright, you have to move a little bit. And those of us who are a little bit more mature and have tears in our hip and arthritis and whatnot, sometimes you just got to work through it. And it can be fun, sometimes. And so I highly encourage everyone to go out there and to at least experience it. So sitting at home watching cable news all day long is probably
It's
the
not.
worst thing you can
Yeah.
do.
Well, and I think if you're not using your mind, you're definitely losing so many things. Because
Right,
that's what I
exactly.
find with older people. They just sit in front of the television all day and they're not.
Well, some do, not the ones who show up at my place for the
Yeah.
most part.
But you got them
But
on hormones. You got
I got I got 85-year-olds, riding horses and still and racing cars, right? And competing in ballroom dance competitions. So and as I mature, it's becoming more important to keep that up.
So kind of tell me about the process of the Exomind, how it works and how the pulses
Right.
are delivered.
So Exomind is a brand. It's made by a company named BTL, and it's the latest technology uh, that utilizes this transcranial magnetic stimulation. So again, like I said, it's a magnetic coil that sends an electrical current through it that causes we place it just against the scalp, and it causes the brain to um, uh, uh, contract and expand. Um, you feel relaxed when we're done with it. When at the end of it, sessions take anywhere from 18 to 25 minutes. The equipment's so sophisticated that it'll actually calculate where it needs to, what areas of the brain need to be stimulated, and it will calculate the exact amount of stimulation that you need. You don't have to. It's all done. I don't have to do any of those calculations. It's technology that's been around for over 40 years. It was first used in England in 1985. And again, they used in a magnetic coil. These the same as the MRI. But the earlier versions were kind of primitive. You had to attach electrodes to your brain. Sometimes some of them you had to actually almost, it's almost like take needles and insert them in, under the scalp. It was quite painful. So Exomind is the brand that the newest. It's only been out since January, and basically the patient either sits up or lays down. There's no anesthetic. We put the coil just against their scalp. We do some calculations. It tells us where the exact areas that we need to stimulate. Then we reset it, and it kind of runs on its own. I mean, it's all automatic.
So
There's no
are you doing an EEG so you know kind of where some of the brain stuff is going on?
well, it, well, we well, if when you become experienced, it's not that we don't do EEGs. Most of the patients that we have either had them done, for whatever reason. EEGs are going to tell us, do they have brain waves? Do they have seizures? Pretty much that's it. CAT scan will tell us, do they have any lesions that are there, that any lumps or bumps that shouldn't be there. And same with MRIs. Did they have a little stroke? Did they have a big stroke? We've had patients with that have been totally paralyzed on one side of the body. That yeah, that we we're not restoring physical function. We can't restore the brain tissue that's been destroyed, but we can certainly strengthen the brain tissue that's left. And so these patients come in and they're almost comatose. I mean, they're barely functioning at all. They're slumped over. They barely eat. They don't sleep very well. They're agitated and irritable all the time. The families are tearing their hair out, and sometimes it only takes 1 or 2 sessions. They're much calmer. They're more alert. We have one patient. He was a college professor. He was only in his 50s. He had a brain bleed. His whole left side of his body was paralyzed, and it was 2 years later we started seeing him, and he went from pretty much a vegetable to he's now reading. He's actually got a little bit side job now. He's actually grading college papers again, so he's become fully functional again, and again, this wasn't part of the plan, but the physical therapist tells me that his foot is starting to move a little bit. So hopefully, we'll make some more progress there. That's really not our focus, but we'll take it. So,
and our focus is really depression, anxiety.
Yeah. So this is FDA approved. It's approved for a number of entities. One is major depression. 2 is it's bulimia, addictions, and anxious, what's called anxious depression. So anxiety in depression. So those are the FDA approved indications for it. And subsequently, we've done some off-label treatments because I'm always outside the box.
Yeah.
And so we've been treating ringing in the ear. We've had some success with that. We don't just use the TMS treatment with it. We use some peptides. Those are growth hormone derivatives. We do some. I'm an acupuncturist. We do some acupuncture with that also. And we'll use and we've been using some and now not the psychedelic, but we were using the legal. We've been using mushrooms, which again increase this brain derived neurotrophic factor and improve brain function.
So another question I have for individuals with TBI and specific symptoms or challenges, has the Exomind shown promise in addressing some of this brain fog, cognitive function, mood changes, anxiety?
Oh, yeah, absolutely. All of these things. I mean, think of it as sort of just a giant calming entity. It's almost like being, going in, agitated and irritable and coming out, almost like going into a bubble. 20 minutes later, you're calm. You're able to think. You're able to function, and go about your day.
So you could probably get a patients off their SSRs.
Some we do some, yeah, we do some. We don't tell anybody, to stop anything. Most of the time, they'll say, I don't think I need this anymore. Can we stop it? And if they have other physicians, especially the psychiatrists or psychologists that are more specialized in those areas than I am, I always want them to check with them. I don't ever want to interfere with with anything that they're doing with anybody else, especially if they're doing cognitive behavioral therapy, talk it out therapy, and we don't want to interfere with that. But yeah, we've had patients decrease their medication, stop their medication. It's not unusual. It's not a surprise.
From your perspective, how might Exomind change the landscape of TBI treatment in the future?
Well, again, this is at the moment it's used as a second or a third line treatment, but I fully think that we would do well. Getting patients on this, as soon as their their heart rate and their blood pressures and all of the vital signs are stable. The sooner you get them on this, I think the better off they'll be. The quicker we'll get them back to as best we can the way they were.
Now, have you worked with any autistic children?
We've had a couple. We've had a few, and we've had some success with that. You probably remember a few years ago we started looking at the hormonal abnormalities in these kids. It's mostly boys, and they seem to have very high testosterone levels, and so we start to bring them down, and we do them with herbal remedies. We're not using puberty blockers or anything like that. That's not what we do. But there's a great number of herbal remedies that'll work pretty reliably. Spearmint tea, believe it or not. Two tea bags and 1 cup of water will decrease testosterone levels in about 4 weeks by about 20%. And you get a 10-year-old with a testosterone level of 674, which is what he should be at 25. You're going to have some behavioral issues. So we always look at that. We try to get a hold of that. They have to eat right. These kids are extremely sensitive to gluten. The inflammatory proteins. So we have to get them off gluten. You got to get them out of the house, get them off of. I guess Nintendo is back in my day. Nobody's on Nintendo anymore. Get them away. And whatever's the latest game craze. You got to get them off of the screens as much as you can. Fresh air, sunshine, what grandma and grandpa told you way back when still works. Yes. So we want to, optimize their hormones. Again, a lot of these kids are, the boys, the testosterone levels are high, and the girls. A lot of the girls end up with like polycystic ovaries, which is blood sugar abnormalities and testosterone issues. They get oily skin and acne, those kinds of things. And for the behavioral issues, this would be great. I mean, all they have to do, and a lot of them have a hard time sitting still, at least initially. All they have to do is, and they don't have to lay down. They could be sitting in a chair. They could be reading a book. They could be looking at their iPad. As long as we keep the coil just next to their scalp, it's covered with a piece of plastic. It's again, there's no needles. There's nothing. There's nothing invasive. It does make a little ticking sound, but they get used to it after a while. In fact, they kind of get used to it. So
your brain's being shocked.
I don't really have any statistics on autistic kids. We really haven't had that many, but we've had some pretty good success with them.
The other question I wanted to ask: what do you see the future with Exomind?
I think we're just at the beginning here. Like I said, the technology's been around for 40 years, but Exomind, this brand, makes it so much easier to use. I mean, basically, I'm pushing a couple of buttons. I make sure the coil's in the right place, and off you go. And like I said, it's very relaxing. The patients go home. They feel great, and after, depending on what the issues are, after so many sessions, 6 to 10 for simple problems, up to 30 for really severe emotional issues. It's actually lasts for quite a while too. It'll last 6 months to a year after the first sort of session, and it can last a year to 3 years. With subsequent sort of follow up. So we try to do follow up so that we don't slip back to the way we were, and we have a pretty good track record with that. It's still kind of new to us. We've had it since March. This form has only been out since January. Although, like I said, the technology itself is 40 years old, so we know what to expect. It's just kind of it's a better mousetrap than what's been out there before.
Well, it's a lot easier to use.
It's very easy. I mean,
Yeah,
I can teach I can teach anybody how to run it in about 20 minutes.
yeah.
It's
Because
very
I've been
easy.
exposed to many different brain machines, and this one seems a lot easier than the TMS and the EMBP and the MERT.
Yeah, those are, and again, they all have their place, but this is sort seems to be like the culmination of them all.
Yeah,
So we're
that's
really
what I was reading about. It's definitely a combination of everything.
yeah, so we're really happy. We're happy with the results. It's ease of use, non-invasive, no needles. I don't even have to use not even ultrasound, nothing. You just lay there, relax. We have make it a nice atmosphere, and off you go.
So, what do you hope listeners will take away from this discussion about TBI and Exomind?
Well, first of all, uh, you know, there's always hope, and 2 years from now we're going to come back. We'll probably come back and do another podcast, and we'll have something that's not even on the horizon, at this point, to present to the viewers. It's Exomind is a giant leap in the world of taking care of brain health, brain injuries
Yeah.
with little to no downtime. There's no downtime, little to no side effects. About I should mention side effects. So the literature says that 17% of the patients in the first one or two treatments will have headaches. There's rare instances of inducing a seizure. I've not seen it. I've not even have anybody come close to that. Um, and I mean, it's pretty benign as far as things going wrong. I mean, the worst that we've seen is nothing, and that's quite rare.
Well, and what I love more about this Exomind, it treats a variety of different things with
Correct.
with papers behind it, white
Correct.
papers behind it.
Like I said, it's been around for 40 years. It's got FDA approvals for
Yes.
a number of different entities, and we keep pushing the envelope a little bit with some of the more difficult treatment protocols, especially things like I said, like ringing in the ears, balance issues. Those are two big ones. And we don't have a perfect track record, but we're running about 55% with an improvement of again a subjective improvement of up to 80%, and another 20% of improvement of 50%, and a very small number. 3 patients out of maybe 50 said that they had no effect at all. So,
Interesting. Well, and
so
I
that's
think
actually a pretty good track record.
very good. And I think this is, the one of the steps that need to be done in the beginning. It seems like this is the last step that people are looking for sometimes because they don't know this is
Well,
available.
it's not been widely available, and it's sort of been hidden away. And again, it's been difficult, and it's so what uh, your viewers should know that what it is not electroshock therapy.
This
It
is,
seems to
yeah.
sometimes get mixed up with that. It is not that at all. Okay, we don't need anesthesia. We don't induce seizures. We don't lobotomize your brain. We actually enhance it.
Well, and it remaps the brain in so many ways, and your
It
brain
does.
can be remapped.
Yeah, it does.
Well, thank you so much for having us on your podcast tonight. And Dr.
Okay.
Clearfield, we look forward to posting this on your website and also getting it out to the public.
Okay. Thank you so much.
Thank you.
We must do this again, but more than every 2 years.
Yes.
Okay. Thank you so much.
That was good. Yeah, because a lot of people just don't know what it
I
is.
was seeing half your face though.
Yeah, that's what it does. That's the problem.
Is that okay? Or
Yeah.
were you seeing half of my face?
No, I saw your whole face.
Okay.
So let me show you the.
So it's already recorded?
Yeah, I got it recorded, and I'll get it up.
Okay. Can we put it on our? We have a YouTube channel too. So usually I send it to Raj or Cool G. They just had another baby.
I know. I'm super excited for them. Are they doing your website?
Yeah.
Okay. Because I can help with that. Because I communicate with them very well. All right, let me find the brochure. I think I just accidentally erased it. They're good people.
All right. So that was fun.
Yeah, I think I'd like to do one on the
Do the M-Cella.
M-Cella. Because that's another thing that people just don't know.
Do the M-Sculpt.
M-Sculpt too. I'm just creating your podcast. This is going under Clearfield. But see, it's so much easier with the software. Didn't you think so?
Yeah. Mm-hmm. This is the same one. What's her name?
Rhonda.
Yeah. I've never seen it before that. We always use Zoom.
I have a hard time with Zoom. I have had more luck with this one and gets out everywhere. Have you talked to Jen?
No, I haven't talked to her in a while.
I talk to Dr. Aaron all the time. He says they're deader than a doornail.
Huh?
They're dead. They don't have a lot of business.
Oh, I'm sorry. I hate to hear that. I went down there. I haven't been on there in a little while. It's just, when I got all this stuff going on.
Yeah, you got to be here.
You got to be here. I was going there on Fridays, but it was kind of, like a dead, a wasted day. She offered me, I could go down there and rent, or I could go down there and be part of their group.
Yeah.
But we got kind of hung up on, I have an asset here, it's worth something.
It is worth something.
We couldn't, I don't mean the building, I mean the practice.
Well, you have everything under one roof, I think it makes it a lot easier.
Yeah, they have a nicer roof.
Yeah. Well, we can always redecorate yours if you want.
Well, but they have a nice place and they have room. We're on top of each other here.
How's Paul doing?
Who?
Your friend that's the nurse.
Oh, yeah, well, he's okay. He's a little bit of a crazy person too. He wants to go to medical school at some point.
Are you serious?
I said, well, what'd you go to nursing school for?
I said, just become a nurse practitioner. Okay, here is, whoops. And I can, we're going to put your logo on it too. That's one of the things that's missing. But if you want to, you put the M-Cella, Exomind, and the M-Sculpt on this. You can
put our name on there somewhere?
Put your name on there. And your logo.
Do you have the logo?
No, I need the new logo.
Well, for the practice, it's the same. The new logos, that was for the AOS. That was for the...
No, I need the one that says Clearfield Medical Clinic.
Oh, okay.
Can't you change that?
All right, let me get this guy's prescription and then I'll get it to you.
Get the other page. Here's the other side. Oh, I can get discount on printing. So, and I can get I'll put the logo on.
Isn't there like too much wording? Is it too wordy?
I don't think it's too wordy. It tells what each thing does, and
Okay.
it's super. You know, we got the pictures in there, and there's a short blurb of what it does. And then, do you want me to work with Raj on the website? Would that help?
I got the other one working on the website now, so just leave it.
Okay.
Let's leave that be for now.
Okay.
Okay. So we'll see how long that lasts.
I mean, we were talking every day forever.
Okay, let's see. Want some money for the salad?
The what?
The salad.
Oh, no. But can I get the other part of my loan? That would help.
Wait till next week.
Oh, can you give me this 1,000 today?
All right.
That would help. It sucks. And then I'm going to really start like I have been. So if we do stuff at night, then nobody knows.
Yeah, and then I'll be confused of having an affair.
Oh, God.
I'm having affairs with Dawn all the time.
Oh.
Don't you know?
I don't see you even. I
No.
think you're kicking her to the curb more than anything. Oh, and I want to ask for the $1,000 for August. Is there any way I could get some Botox? Because I represent you all the time. People go, "Where do you go?"
Yeah, I'm running low.
Do you have Sculptra? Or not Sculptra, the one that lasts long? Do you still have that?
Daxify, no.
No.
I don't like that stuff. I threw it out.
Oh, you did?
Okay, here you go.
Thanks. Appreciate that. And then do you want to do the Emsella next Wednesday or Tuesday?
I may be doing a talk here next Wednesday.
Or Monday?
Yeah, probably Monday.
Okay, we'll do it Monday.
Let's see what we got. Oh, you need the logo, right?
Yeah. And I'm going to get Joel home. So
Monday's the 28th. Okay, my last one starts at 3, so it should be done by 4.
Do you want me here at 4? Or they get all pissed?
Oh, yeah. 4:30.
Okay.
Okay, logo, right?
Yeah.
Let me find it first.
And seriously, if you need help with the website, because I've worked with Raj for 2 years.
Yeah, I know.
Oh, this is. And there's a company called Bill Flash that will take people with 500 score credit. So I wanted to send you that information. Or do you want me to follow up with it? And
what's it called?
it's called Bill Flash. They do. They make payment. People can make payments.
You like this one?
Yeah, that's pretty. I like that.
Okay.
Do you like that one?
Yeah. Mm-hmm. Yeah, I made it.
Oh, good.
Bill stuff, best to see here. Okay.
So I'll get you in contact with Bill Flash and I'll have him get a hold of you. That might be the easiest. Oh, the other thing I think you should promote is your stem cells and exosomes. Because when I was working at Regeneration, I mean, they had so many people coming in. And I know you love that stuff.
That's pretty lucrative.
Yeah. So want we put a marketing plan together for that?
You got to be careful with that one. The FDA doesn't like it. They shut you down for
well, they just
false advertising.
Well, they did other stuff. They say joint pain. They would say, yeah, they never use stem cells at all. They do these dinners, and like 40 people would come or 20, and 20 people would sign up at $30,000 a pop.
Yeah, I never tried that. All right, I'm sending you two. I'm sending you a pink one and a blue one. Okay, you can use them both.
Yes, thank you.
Send it to somebody now.
I'll put you up here too. Oops, draft.
Okay.
Okay, and I'm going to put you on this email with Jonathan with Next Trust that does this great financing.
Okay, so I sent you two. I sent
Perfect.
You a pink one and I sent you a blue
awesome.
One, so.
Do you have any Disport?
I don't have this.
Okay.
I only have a little bit of. I'm getting stuff tomorrow. So,
okay, we'll do it next week.
I have a little bit of. I use Juvo.
Juvo's perfect.
I think that's of all of them. I like that the best. It takes quicker. It lasts longer, and I get a good price for it too. I get it for between you and me, $350 a bottle.
Oh, that's great.
Botox is $620 a bottle. The other ones are over $500.
Wow.
Okay, did you get the logos?
Yep, I did.
Here's the blue one.
Ooh, I like that one. Okay. I like that one a lot better.
You like that? Elevating excellence.
Yeah. Hey, that's what you do.
I'm a dumb boy.
You're not a dumb boy.
If I'd stayed in my lane and didn't get these damn machines, I'd be like living like a king.
Well, we're gonna get people to them.
Huh?
We're gonna get people to them.
All right. What else do we need to do?
That's it.
I need to start. I need to go move.
Okay.
I'm going to the gym.
Okay. I can do the rest at home.